Okay. There you go. You're seeing my screen okay there? Yep. Terrific. Okay, so just welcoming everyone to the Pain Revolution information session this evening about the Local Pain Collective initiative for Western Victoria Primary Health Network region. So I'd like to start by acknowledging the traditional owners and custodians of the lands and waterways from which we are all zooming in from today. We recognise their diversity, resilience, and the ongoing place that First Peoples hold in our communities. We pay our respects to the elders, both past and present, and I wish to extend that respect to any First Nations people connecting in today. We commit to working together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for First Nations peoples and organisations, and will work together on closing the gap. Okay, so just a little bit of housekeeping to start off with. Once I've finished speaking, I'll pop a link into the chat where you can see upcoming events for Vic PHN. This session is being recorded and will be shared on the Pain Revolution YouTube page and also the Vic PHN Learn page. And you can see there over on the right that many of the Vic PHN education sessions are recorded and freely available for you to watch. So feel free to have a look at those. I'll pop a link into the chat for that as well. The attendance for this evening's webinar will be shared between the two organisations. Participants will be on mute for the duration of the session. If you have any questions, just pop them into the chat box and the panel members will be monitoring that and will either answer them live or answer them directly into the chat box. There will be a very short evaluation at the end and also an expression of interest to find out more or becoming involved in the collective. So keep an eye out for those at the end as well. So the learning outcomes, which you would have seen on your invitation, is to understand the mission of the Pain Revolution regarding driving conceptual change towards better care for patients with persisting pain, to understand Pain Revolution's upcoming Local Pain Collective's support model, consider becoming involved in the Local Pain Collective, and to build knowledge about available resources, supports, and referral pathways. So the agenda tonight, you'll see I'm going to start off with just a little bit of background from our population health and planning team around the figures around persistent pain in our region. Then Professor Lorimer Mosley will take over and he will talk about why we need to have an educational focus with persistent pain issues. Then Abby Norrish will jump in and talk about the Local Pain Collective initiative. And we will round off the evening with a short presentation from Tanushka, who will introduce the LPEs, the local pain educators, that will facilitate the Local Pain Collective in your area. So lots to get through. So I'll just start off with a very short presentation on persistent pain in our region. To do that, I'll just start with persistent pain in Australia. So it might not be news to all of you that 1 in 5 Australians aged 45 years and above have chronic pain or persistent pain. It is associated with many common health problems and complications. However, there is no local publicly available data, which is quite challenging when we are trying to talk about our local region. GP presentations for chronic pain have risen 67% in the past 10 years. In 2018, chronic pain cost an estimated $139 billion in Australia, mostly through reduced quality of life and productivity losses. And people with chronic pain are 3 times more likely to be prescribed opioids and other analgesics. I'll just pop over onto the next slide here. So as I said previously, there is no local publicly available data, despite the importance of chronic pain in primary health care. So what do we know? Although the direct measures of prevalence of chronic pain by local government area is not available, we are able to look at measures such as hospitalisation rates and opioid prescribing down to SA3, which gives us a picture of chronic pain in our region. So what is an SA3? Well, that's a statistical area level 3, and they're designed to provide a regional breakdown of Australia. They generally have a population of between 30,000 and 130,000 people, and they often closely align with large urban local government areas. So you will recognise some of these as we go through. So we'll just start off by hospital admissions. So in the West Vic PHN region, hospital admissions for musculoskeletal system diseases were highest in the SA3s of Great South Coast and the Wimmera Grampians, which you can see here. I won't spend too much time on these figures because there is quite a bit of data in them, but you can see that, that there are areas that have higher hospitalisation rates than others. For musculoskeletal system disease, the estimated rate of disease is more spread out, with higher rates in Warrnambool, Ballarat, Grampians, Barwon West, and the Maryborough Pyrenees SA3s. So opioid prescriptions. So with the exception of the age sex standardised rates in the Surf Coast Bellarine Peninsula, all of the SA3s within this West Vic PHN region on the graph there have rates of prescriptions dispensed for opioid medicines above the state and national averages, which is quite a sobering statistic. There are particularly pronounced, these are particularly pronounced in Maryborough Pyrenees, followed by the Grampians. So at the Australian Prevention Partnership Centre chronic pain project workshops in 2019, most of the PHNs, including West Vic PHN, reported that they were taking action to address the issues of persistent pain through a variety of means. West Vic PHN routinely delivers GP education, such as the prescribed drugs of dependence workshops and other initiatives as well. The Persistent Pain Echo is a multidisciplinary community of practice which was set up in partnership with TAC and WorkSafe Victoria. We delivered 30 sessions over 18 months. We're also the pilot PHN for the rollout of SafeScript, which included intensive education delivered in the lead up and implementation phases of SafeScript. And West Vic PHN was also proud to allocate $100,000 towards 8 Pain Revolution scholarships, which involved the upskilling of 2 practitioners in each of our 4 sub-regions, so a total of 8 sponsorships. The recipients of the scholarships are now involved in the local pain collectives program, which is what's being discussed today. So it's great to see that work and all of that study, hard work by the recipients coming to fruition. So that's it for me. I'm now going to hand over. I think I've stopped sharing my screen now. I think, Abby, were you going to do the introduction for Lorimer? You're on mute, Abby. Always someone.
Always.
Yeah.
So hi everyone, I'm Abby Norrish. I'm the local pain collective coordinator, and I would like to introduce our CEO, pain researcher, clinician, educator, and avid cyclist, Professor Lorimer Mosley, to chat about why we need to have an educational focus with persistent pain issues. So without further ado, welcome Lorimer.
Thanks, Abby. Hi, everyone. Thanks for coming. I'm going to share my screen, and I always find this really hard to do. So I'm just going to do my best. And Abby, can you tell me whether you see my slide there?
Yes, I do.
And do you see now an entire slide, or do you see my little presenter's view?
I see an entire slide.
Beauty. All right, cool. thanks so much for having me. I would like to start by acknowledging that I live and work on the country of the Kaurna people here on the Adelaide Plains. I pay my respects to the Kaurna elders, those presently telling stories and holding the wisdom, passing that on, and emerging elders, and as well the elders of millennia past. I'd also really like to add to something you said, Katrina, about the hard work of these local pain educators that is now coming to fruition. It is hard work, and they really have busted their guts. And someone asked me the other day, what's been the most exciting thing for you at work in the last 2 months? And I didn't hesitate to say, meeting some of these people coming together. I've met them before online, who are working so hard to serve their community and the people they treat. And I dip my lid to you guys. So well done. Anyway, that's not my brief. So my brief from Abby. Oh, and by the way, I'm wearing a brand new T-shirt just for this. I just got it about 30 minutes ago. Hope you can see it. It's a Pain Revolution T-shirt that says, "Go the distance, make a difference." I raised enough money for our campaign to get a free T-shirt. It's very schmick. Anyway, why is Pain Revolution doing this? And why do we want you to be a part of it? It's my alternative title to the one that was suggested about education, but you'll see that that's exactly where we're going. Before I start, I have to let you know that I have conflicts of interest all over the place, actually, or potential conflicts of interest, because I am a scientist and I'm a communicator and I write books, for example. So I get royalties from books that are very relevant to today and to the local pain educator program. What I do with those royalties is they go back into the objectives, I guess, but nonetheless, I get them. I've also been supported for travel or registration at conferences, or occasionally for free stuff, like a scooter once, from these companies. And the companies I've got in green there are particularly relevant to tonight because, again, they're involved directly in consumer, healthcare professional, or decision maker education programs. My research is supported almost entirely by government, and that's just mostly Australia. The Victorian government has given us some money to do research, and we accept industry money from insurers to do research. Okay, so that's all the technical stuff over. I was wondering whether there's any point in us trying to take on the challenge of persistent pain, because back pain is the biggest one, but clearly it's been cured. If you have a look at all these cures, some of them are quite rapid. I feel quite sorry for the person who, or the people who developed the 7-day back pain cure. Someone else developed a 10-minute back pain cure, which is clearly better. How are we going really? And the stats that Katrina put up are sobering. And if we were only talking about back pain, and persisting pain, there's lots of shapes and sizes, but if we are only talking about back pain, we would still conclude that we've got a long way to go. The global burden of disease data, now these data are now 2 rounds old, but the message is identical and possibly a little bit more sobering. And that is that low back pain, in terms of years lived with disability, is the world's biggest health problem. And just think through that for a moment, that low back pain in terms of years lived with disability and in terms of economic impact. Low back pain, then we add neck pain, we add other types of persisting pain. It's our biggest health burden. It is the most common reason for people leaving the workforce early. And when people leave the workforce early, they are more likely to suffer disadvantage in older age. It's associated with increase of depression, suicide, stress, stroke, drug dependence, alcohol dependence, cancer, diabetes, and obesity-related diseases. And a paper published just in the last 2 weeks clearly shows that it's associated with increase all-cause mortality. So if you have persistent pain, it increases your risk of death through a range of causes. this is a really confronting statistic, because historically we've said, okay, you don't die of chronic pain, but it ruins your life. And maybe we need to revisit that. So why is Pain Revolution doing this? Why did Pain Revolution start at all? Well, the most pressing reason is that the burden of persisting pain is massive. The burden of persisting pain outside of the cities is bigger than it is inside of the cities, and there's a lot of contributors to that. But the data that Katrina put up, particularly on opioids, is quite compelling as an example of that. And if you look at the map of Australia, the healthcare atlas, it's very clear that outside of the cities, we're not, I guess, outside of the cities, we're doing even worse on this problem. And there are some very significant structural and other contributors to that. Why? That's not an impetus enough. The next thing that I think motivates Pain Revolution is that the evidence that pain is a biopsychosocial experience is overwhelming. It is absolutely overwhelming, that we can no longer hang on to the idea that pain is simply a measure of the state of a tissue or the health of a tissue. And we have a phrase in Pain Revolution that goes, the old view was that pain is about detecting damage, and the new view is about pain is about protecting you from damage. And this is a really significant mind shift. But we also know that thinking and treating people in pain in a biopsychosocial way is both effective, very good evidence for that, and difficult. It's very difficult. It's not, regardless of your profession, it's not an easy thing to do. I imagine that most of you will relate to statements like this that you've heard from people in front of you, and maybe they've come out of a pain program. The program was not really for me because I have real pain. You might have heard something like that. You might have heard something like this. No disrespect to the rest of the group, but my scans show my shoulder is actually painful, not imagined. I know some people just need to get on with it, but I know my pain is definitely not in my head. Some of you, if you've been around pain patients a lot, you might have heard statements like this: my dorsal horn or my spinal cord is injured now. And they're talking about a sensitization in the system. There's nothing else that can be done. I've got a disc degeneration disease. It's not a matter of if I get surgery, but when. These sort of statements that come from patients are so hard to deal with, so hard to engage with. I've got central sensitization pain. My only option now is a stimulator to block out the pain messages. And these last few are really touching on the ways that we make mistakes trying to educate people in pain. We also know that learning how pain works makes thinking and treating in a biopsychosocial way more effective and less difficult. We also know that learning a modern view of how pain works is associated with recovery. So in this statement, learning how pain works makes us as healthcare professionals better at what we do and more effective. And when consumers understand how pain works, they're more likely to recover. And there's one more reason that we do what we do, and that is because consumer expectations and community norms are well behind the times. Consumer expectations are often, the data show, for outdated models of care. So even when you are a biopsychosocial practitioner, you often are dealing with consumers who don't want a biopsychosocial approach to this. So these expectations are really difficult to engage with. And our research tells us that the biggest barrier that biopsychosocial thinking clinicians report to delivering care is that their patients don't want it. So how do we shift all of these contributors to this situation? Well, here's some data that have been collected over quite a long time. They're just audit data, and the reference in the top left, which was actually 2015 or 16's most cited paper in pain, addresses data from half of this cohort, but they do the same thing. So the big cohort now is 1,600 people that show that for those people with persisting pain disorders of all shapes and sizes, when they understood a modern view of how pain works, they had a great response over the following 12 months. So this is over 12 months, a gradual reduction in their pain and disability scores. For those people who didn't, they had no shift. And during the rest of those 12 months, these people are receiving guideline-based care. So what this tells us, there's a few things this tells us. One is that without understanding why certain treatments are effective, then people are much less likely to engage with them, and they're much less likely to have a good outcome, if that makes sense. Unless consumers understand that, I'm not sure if I said that the right way. Understanding is good. Learning a modern view of how pain works is associated with recovery. And hopefully you'll agree, this 12 months after onset in a persistent pain group, this is at last a great outcome. But it's only in these data, it's only happening in about half of the patients that are being seen. So we need to be better educators. And in fact, we need to broaden our scope for education. I've been rather cheeky here and just taken a quote, and this is against all the recommendations that I give people when I teach them how to present about science. Don't put so many words up, but read this with me. This is an excerpt from an editorial that I wrote, all right? But it summarizes. Here is the case for pain education. Contemporary pain education is potentially more powerful for persistent pain than drugs and as powerful as anything else we can offer. Education is a missing link that would actually make advice to be active, to exercise, and to consider psychological therapy a sensible strategy for back pain and other pains. Research shows that when someone with persisting pain begins to understand their pain, they actually engage in active, psychologically informed strategies and can have drastic reductions in pain and disability over the next 12 months. For these people, recovery is back on the table. And I'm going to say the last point again, because I think it's really important. For these people, recovery is back on the table. So Pain Revolution aims to enable healthcare professionals like you guys to understand a modern view of pain in a way that you can integrate it with your clinical reasoning and your care pathways. We want to empower you to pass this understanding on to the people you treat, the people you're not yet treating, the people who come to your school barbecue or the netball club. And by those mechanisms, we want to shift community norms to change expectations that consumers have when they arrive for care. And we want to do all of this basing our expectations and hope on science, on modern science of how pain works, how recovery works, and the evidence to support different approaches. So it's a highly scientifically and evidence-based approach. If you can imagine that all of the people we see are on this curve somewhere and with their access to their own knowledge, their skills, local resources like you guys to prevent and overcome persistent pain, Pain Revolution is trying to shift the entire curve. And we don't have to shift it by much to start to have serious, big impact effects on societal burden. We do that through 3 programs. The local pain educator program that Katrina's talked about, and just so grateful to Western Vic PHN for supporting 8 scholarships. That's just fantastic. Through that program, we provide healthcare professionals with modern pain education through a professional certificate and mentoring and other webinars and training in modern pain education. The local pain collective program, which you'll hear more about tonight, is really about learning circles with some structure and facilitation of contextually specific pain training, and about engaging with the general community in pain education. And then this network that Pain Revolution is setting up, a national network of LPEs and LPC members to support and promote the well-being of healthcare professionals, because we also have data that clearly showed that it's tough out there, that it's tough in rural and regional Australia to adopt a contemporary approach to this problem. And we're here to support and promote your well-being. The LPC program, I hope I don't steal much of your thunder here, Abby. I really hope I don't. But when I was thinking about what are the characteristics of what we're trying to do in these LPCs, The common theme was community. So it's community tailored, community driven, community delivered, community engaged, and community connected. And those 5 community-based aspects of it are really pulled out of the feedback that we've received from the very first local pain educator and LPC facilitator cohort, who have described the shift in the way that they work to be really community focused and community driven, community delivered, engaged, and connected. I thought it might be worth just pointing out what Pain Revolution is compared to what it is not. And I'm going to start on the right-hand side of the screen. So Pain Revolution, we are not about giving you very advanced clinical skills in treating those really tough, really needing tertiary intervention pain patients. We recognise that at one end of the curve, there is a very small group of people who are exceptionally difficult, and to treat them well, we need higher level training. And we link into services that provide those training. We don't provide clinical care. We don't come in and change clinical interventions. We don't provide discipline-specific advanced training. We don't mess around with policy, and we don't accredit and certify. What we do, and we've got evidence to say that we're successfully doing this, is that we change community norms and expectations. Healthcare professionals increase their knowledge, their skills in education and clinical reasoning, their well-being, their sense of connectedness and belonging. This is a quote from one of the LPEs in their feedback, anonymous feedback things. For me and my community, we are connected, engaged, excited, enabled, and empowered. So what's the educational framework that is really forming the structure for Pain Revolution? Well, I'm going to tell you the story of it. Over the last 11 years, we have had input from 350 recovered consumers or recovered patients. So these are people who have had persisting pain and recovered. 36 scientists and clinicians, 6 scientific disciplines and 7 clinical disciplines. And then at a later phase, 220 members of the general public. To distill all of their learnings, consumer learnings, responses to questions like, for your recovery, what was the most important thing you did? Or what was the most important thing you learnt? What was the secret? And we put those things together. Some of those things are covered in Hayley Leake's excellent paper published in Pain this year. And the whole story will come out in a paper led by Carolyn Berryman, hopefully in the new year. But out of that process has come these things that we call target concepts. They range from remembering that all pain is always real, that it's helpful to learn more about your pain, that pain doesn't equal tissue damage. And this can be a really tough one, and we have to be careful in how we engage with consumers on that one. Pain equals protection from damage, not detection of damage. Pain depends on your context. Pain reflects where your internal protection meter is at. When pain persists, it becomes overprotective, but you can retrain your pain system. And the secret is being proactive about it. They're the target concepts that have come out of this really substantial process. We went to an advertising and marketing firm and said, can you make this messaging a little bit tighter and a little bit easier? And this really forms the basis of Pain Revolution curricula. These essential pain facts, so named by a survey of 540 members of the general public. 1, pain protects us and promotes healing. Persistent pain overprotects us and prevents recovery. Many factors influence pain, and there are many ways to reduce pain and gradually recover. This is profession agnostic. It's clinical reasoning bound, and the local pain collectives will really untangle, embed, understand these essential pain facts and their basis and potential power. So we currently have local pain educators across Australia, and here's just some of them. You might recognise a few of these people. I love putting up this slide to see all these happy, committed, community-minded, kind and clever people. So if you're up there and you can see yourself, just give yourself a nice little self-hug of care and gratitude and congratulations. In 2022, we will have local pain collectives across some of Australia. So you can see Western Vic, well represented. And I can't help suggesting whenever I finish a talk, so this is the end of my little session, but I would love it if this is my call to action. My call to action is when you get home tonight, tell someone all about what this was about, as much as you can remember. Join this local pain collective. It'll be transformative. It'll change your life. It'll change the lives of the people around you and treat. And if you're feeling really motivated at some time in the next few weeks, call your local politician and argue your case that we need a pain revolution in rural and regional Australia. And you can help that politician make it happen and become famous and well known for their contribution to society. There are links. Anyway, back to you, Abby. I'm going to stop sharing.
Thank you, Lorimer. That was wonderful. And I always learn something new. So I'm just going to share my screen now. And where to from here? We've got another about 15 minutes of just sharing a little bit more about the Local Pain Collective project and who is in your area. And I always find it really nice to put a picture and a name and a who is in your area so that you can connect with them when you hopefully see them next year. So I'll do the same thing and I'll just get a bit of a thumbs up from you, Loz, if you can see my screen.
I can see your screen. Yeah. And if you, perfect, Abby.
Great. So Loz has shared a little bit about what the Local Pain Collective is, and I'm just going to, add to that. So the Local Pain Collective project is about bringing like-minded health professionals together who have a common concern around persistent pain in their community. And I'm sure many, if not all of you, share this same sentiment. The aim of the Local Pain Collective project is to establish sustainable, community-based interdisciplinary local pain collectives of rural and regional health professionals which deliver peer learning exchanges in order to promote best practice pain education and care. I'm one of the local pain educators, inaugural ones that started in 2018. And in 2019, we set up, me and 6 other colleagues, set up 5 local pain collectives in New South Wales, and me, I was a little bit far away from everyone over there in Margaret River. And we've used that to stem this new iteration of the 20 collectives that are starting next year. I wanted to share a little bit about my experience and my fellow facilitators' experience thus far running the local pain collectives in the last couple of years. We've got some pictures. So on the left is a whole of community event we ran this year in Margaret River. And we had 50 people come, which was excellent. On the top right is Murrumbidgee Local Pain Collective, which is one of our strongest local pain collectives. And the bottom right there is one of our first collective retreats about when we all came together from across Australia and worked out how we were going to go about this. So I guess one of the reasons why I joined the Local Pain Collective was I felt quite isolated in my community with how I treated and helped people living with persistent pain. I didn't know anyone, and I knew that this biopsychosocial approach was something that felt right for me and was backed by good research, but I didn't know how. And it was through joining this and starting this collective that I found kind of my people that were willing to share challenges, to share their wins, and most importantly, over a glass of wine and some really good food. Kylie, who's on the top right, she shared that the biggest thing she's learnt for the Local Pain Collective is that it's been kind of one of the career highlights of her career, and that seeing the ripples of change in her community, and they're just small, have been one of the most rewarding things. And Dan Searle from the Local Pain Collective in Albury shared that it's been amazing for him, he's a physiotherapist, to meet local psychologists, GPs, dietitians, occupational therapists that shared a common concern for pain. And yeah, I really reiterated that. I didn't actually know anyone know any other professions really well. And by bringing people together that share a similar interest has been one of the biggest things that we've all got out of it. So Loz has shared this before, but it's super exciting that we're going from 5 to 20 local pain collectives, and we have some very passionate people, and a lot of you are here on the call tonight who are really excited about this opportunity to start something in their collective and see where it goes. And Tanushka is going to share with you where these collectives are in Victoria, West Vic, and who's running them. So I'll pass over to you, Tanushka.
Hello, everyone. I'm Tanushka. I am the Local Pain Educator Program Coordinator. I'm just going to introduce to you all the local pain educators in the Western Victorian region. We have 7 local pain collective facilitators who will be facilitating 6 local pain collectives in your area. So when I'm just going to call out to you, just wave out so everyone else on Zoom can put a face to the name. So we have Ballarat and Surrounds, which will be facilitated by Grant McKechnie and Karina Saver. Grant is an exercise physiologist based in Sebastopol, and Karina is a physiotherapist in Ballon and Melbourne. Then the Southern Grampians collective will be facilitated by Jessica Fishburn. Jessica is a physiotherapist based in Hamilton. The Surf Coast collective will be facilitated by Charlotte Burns. Charlotte is an osteopath based in Anglesey. The Warrnambool collective will be facilitated by Adrian Benson. Adrian is a physiotherapist working in Warrnambool. The Colac collective will be facilitated by Stuart Canavan. Stuart is a physiotherapist based in Birragura, Campertown, and Colac. And lastly, we have the Wimmera collective, which will be facilitated by Daniel Palmer, who is a pharmacist based in Horsham. These 7 amazing clinicians are all extremely passionate about helping people with persistent pain, and they are hoping to promote consistent messaging and language around pain. Together, they have years of experience, and they are very excited to get started in the Western Victorian region. So get behind them, join their collective, reach out to them, and yes, and let's spread the message. Thank you.
Thanks, Tanushka. So I thought I'd jump through by sharing this QR code, and Tanushka's going to copy and paste a link into the chat box. And it's just your call to action now, the second point of what Loz shared earlier, of the 3 points that he shared, is to open this survey. There's 3 questions. 1 is to write your name, which is not too hard. 2 is your location, and 3 is email. And this will come straight to us, and we can connect you to your local pain collective facilitator. And I thought it'd be really useful just to share that you'll be put on like a mailing list. And we really think that it's about what your capacity is. So we really hope that you can come to all the events, but we also be recording. There'll be different initiatives and different projects that each collective will do. So we just encourage you to join, and yeah, we're really mindful of people's capacity, and that we hope we can really make the sessions really engaging and fun and useful and helpful. And we're always open for feedback, and really believe in evolving and hearing from our local communities, and knowing that the Western Vic community is a different nuance to the Margaret River community. So hearing your feedback is really important to us. That's it from us in terms of the formalities. Just wanted to share just reiterate the 3 kind of great call to actions that Loz just mentioned, and that we would really appreciate and value if you could share and just tell one person tonight about what you learnt, and as much as you can remember, and it might just be one thing, to join a local pain collective, and to call your local politician, or the ideas that I had were Rotary Club member or Lions Club member or football coach or local Pilates instructor, and tell them about Pain Revolution and see if they can help us make it happen in Western Vic, and to support the sustainability of this initiative into many years to come. So that's it from us. We welcome any questions. We've got some time, which is great. So feel free to write in the chat box if you have any questions that we can that have come about over the session, and we'll do our best to answer them. Yeah, so Grant sent me a direct message with a question. So I'm just going to share. He said, and I think Sky Daly Holt has shared. Yeah, great. Could you please give us a snapshot of a typical catch-up at the LPC get-togethers? So I'll share first the answer to Grant's question, which is, what does it look like? And what it looks like at this moment, and it can depend on the local pain collective, because we want to give flexibility in listening to what their community wants. But at the moment, a proposed schedule is that it runs every 8 weeks, and it's a online or preferably face-to-face, now that we're venturing into this new arena where we can meet face-to-face. And it's every 8 weeks, and there's 6 sessions. And what they'll look like is the first one will be really exploring what the local pain collective is, who the community is, and how we can use each other for learning. And the second, third, fourth, fifth session is around the essential pain facts. So Loz shared 1 or 2 slides, and we're really going to drill in to each slide, each fact, and explore what that looks like and what that means for our community. The sessions, in answer to Sky Daly Holt's question, is the sessions look like a welcome. So they're 60 minutes to 90 minutes. There's a welcome, and then there's a 20-minute of didactic learning where you'll learn about the fact. Some really cool information that we think will be really helpful. And when we're creating these resources, I'm the lead of the education team, we've got a whole bunch of people creating these resources. So researchers, people with lived experience, physios, psych. So a whole group of people that are creating these resources for you using the research that we have right here, right now. And then a big part of the session is it's about 40 to 60 minutes. Again, we like their flexibility for the facilitator to make it their own, of engaging and working out how we can apply this new information into our communities. And I think that's the one thing that I struggled with when I started, and it's a forever journey, is that we hear all this stuff and we learn about it, but then applying it and working out what that looks like for the people right in front of us can be really tricky. And that's what these discussions are about. They're about sharing learnings. We had an example is we had a Choosing Words Carefully session this year. And the insights that I gained from my local GP and local psychologist and local dietitian on how they would go about it was just invaluable. And I rated the session 12 out of 10, and I was facilitating it. So they're really great informative sessions. And when we design the sessions, we want them to be fun and interesting and useful. So I hope that answers that question. Thanks. Can there be Zoom participation as well as face-to-face? There will be. It'll just be dependent on the facilitator. So, and their capacity and the community. So, Andrew, you're a part of which one? So, Wilmora, I think you're a part of, Andrew. So is that Dan Tanushka?
Yes.
Yeah. So that's a question that you can ask if you join the collective, Andrew, that you can ask Dan. That would be really useful for you. And then he'll take that feedback and see what they can do. And again, that's just us making sure that we're really meeting our community needs. Any more questions? Great. Awesome. I might just get Katrina to share. She's just posted the survey link, I think, or more
Yes,
information?
I will pop that in again. Thanks, Abby.
No
That was
worries.
such a great overview of, I think if people aren't motivated and excited to join in after that wonderful breakdown of how the collectives work, I don't know what would. It was really wonderful overview. I've just put some resources in about education events. If you wanted to access health pathways, which used to be only for GPs, it's now open to all healthcare professionals. So you can do all of that via our website. I've put in the YouTube Learn channel where you can access previously recorded webinars, and I've just popped that evaluation form in again. So did you want to pop the put the form back in again for the expression of interest? I can copy it in again as well, if you like. We'll have that there as the last one everyone sees, just to send through that expression of interest through to the team if you're interested in being involved further.
Great. I've just seen there's a couple more questions. So
Go for it. We've got plenty of time.
Keith, I've just in answer to your question, I'm wondering where your location is, and if we could link you up with the facilitator there to help answer your question in terms of are clients expected to pay for the 6 sessions of the education, or is it one-to-one or group session? So the local pain collective events are for health professionals. So 5 of them are for health professionals, and it's about learning and sharing our information together with the goal of how we're going to apply this to our community. Oh, great. So Grant is fully across this stuff. So any questions that you have or any things that you're looking for, I would definitely send a direct message to Grant in regards to that. You did bring up a good question that I didn't actually mention, and I just want to reiterate there is, or share. The last event is actually for the whole of community. So there's 4 sessions that are for clinicians, and the idea is then the whole of the collective then organise this big fun event for the whole of community, which shares those essential pain facts. We did this in Margaret River just in August, and we had exactly what we were sharing before in terms of all of the public. So people that, patients and clinicians, but also people like people in the PHN and the Rotary Club, leaders, because we wanted to give a bit of an idea about why we're here and what we're trying to do and who are the people in your community that you can look to. And a great question, an email that I got a month ago was, I've read Lorimer's stuff and I'm really on board with it, but there's no one in the whole of WA that knows this stuff. So I just don't know where to go. And it was great for me to be like, oh, well, actually there's 20 minutes away, there's a physio that's really interested in this, and they could look through some community options of pathways that would help you to learn about more information. Or I can link you in with the Pain Rev site and our resources. So I did want to just share that we are really aware of reaching out to a community, and we're also looking at other ways that we can do this in terms of other initiatives. So always open to suggestions. And the last question that I have was by Delia: has there been much of a focus on involving surgeons? I tend to find people who have been told something by a surgeon are really hard to get on board. So we do have, you might have more to add here, Loz, but we do have GPs and pain specialists on board. With the collectives, we're really looking at engaging people that are interested in learning more about pain. And a big part of the local pain collective goal is to work out how to reach out to other professionals such as surgeons in our community to get them on board and see if we can collaborate and share ideas and thoughts. So, but I do understand what you're saying there is it is really hard when someone comes and they said the surgeon has said this and the level of credibility is high. So they're obviously reluctant to see a different way of going about things. And that's kind of the conversations that we have in the local pain collective. Like, how would you go about this as a psychologist or as a GP or as a physio or as an OT? And I know I'm missing heaps of people and professions. But yeah, these are the kind of conversations we're having in the local pain collective.
Can I just jump in on that as well, Abby?
Yeah.
I think that's such an important question. And the only thing that I would add to your excellent response, Abby, is that the LPCs are in part about building relationships and utilising the relationships that each of the LPC members have outside of that LPC. So, if you're in a community of healthcare professionals, the chances that one of them already has a good relationship with that surgeon is elevated. And the discussions that are most helpful are those respectful, empathic, bi-directional discussions that people have once they've built relationships. So the surgeons is a really challenging one. And I guess shifting the entire curve of understanding and expectations will slowly reduce those occasions that we're hitting. But it is a slow journey. But we've already heard stories of people introducing the idea of the LPC to their surgeon mate, who mentions it to her surgeon mate. And then these sort of links are starting to reduce the likelihood of those situations. But it certainly is a journey for which we need patience and persistence and supporting each other and all that sort of stuff. I just also wanted, in response to your question, Keith, just to make sure everyone knows, and maybe this is just me being paranoid, that the LPC meetings are not, no one pays for them, just in case that was a misunderstanding. I hope that was clear. Actually, it's not like no one pays. We pay for them, but no one pays to participate.
Okay, Abby, I've taken my camera off because my internet was being a little bit sketchy. Were there any other questions coming through? You can raise your hand or pop it in the chat if you have any pressing questions. Otherwise, we might wrap up and get an extra few minutes back into our evening. No, so look, I'll just take this opportunity to say a huge thank you to Lorimer, Abby and Tanushka. We're so fortunate to have such expertise available to us, and it was so informative, really enjoyable evening, and it's such fantastic work. The PHN really enjoys working with the Pain Revolution. We've collaborated on a number of things over the years, and it's always such a joy to work with your team. So thank you very much for such a great information session. It's also terrific to see the faces of the local pain educators in our region, and thank you so much for all of the hard work you've put in and will be putting in over 2022. So we really hope that you'll consider becoming involved in the local pain collective, and yes, contact Abby and the team to find out more information. Thanks everyone.
Thanks, you're all legends. Thanks for having us.
See you guys soon.
Ciao, ciao.
See ya.
Yeah.